Have you heard of Rome-Held syndrome or the gastro-cardiac reflex? So what this means is that gastro is referring to stomach, cardio referring to your heart. A reflex is something where they're interacting with one another. So if you're somebody who has suffered with acid reflux, hiatal hernia, bloat, and then also suffered with heart palpitations, then that's exactly what this is referring to. So it is a known reflex. It's known to some degree. It's not widely known. So if you are somebody who's been suffering, yet you've been to a cardiologist or you've been to a gastroenterologist, and knowing your body and maybe having suffered for a while, you tell your doctor, I think they're related. I think that my heart is related to what's happening gastrointestinally. In other words, I'm more bloated, I'm more full, I feel pain, I'm more uncomfortable around that area of my stomach, and then the heart seems to be affected by that. And unfortunately, you've likely been told, no, there's no association, which is absolutely untrue. The association is understood, but excuse me, it's not widely understood. So the problem is that, well, the research actually says that acid reflux, gallstones or gallbladder malfunction, and hiatal hernia are causes of this. So that's what the research states. But research and then day-to-day knowledge of your clinician doesn't always align. But that's the case. So if you've been suffering with this and you're seeing that association, but you're not getting any confirmation of it, I'm here to tell you that there is absolutely confirmation. Now, what concerns me is what's considered sort of standard of care treatment. And it is a list of drugs. So there's drugs that increase your blood pressure, there's drugs that decrease your blood pressure for the same condition. So drugs that bring it up, drugs that bring it down, anticonvulsive drugs, antacids, of course. What else was on my list? Yeah, those are the big ones. And so the problem is that, of course, all drugs have side effects, and the side effects of these drugs are anything from feeling weak, feeling lightheaded, feeling anxious, feeling depressed, getting headaches, nausea, GI complaints. So all the symptoms that you have going in are now aggravated by the side effects of the drugs you're being given. So we have a problem here because we are in a medical model that only thinks drugs. It's like, okay, here's the symptom, how do I manage the symptom? They call it a drug or a pill for every ill is the expression. And the problem with that is that this is a syndrome. You have a stomach that's being compressed, creating acid reflux, acid coming up your esophagus. As the compression happens, the stomach moves up into the diaphragm, which is a very forgotten organ. And then you've got stomach, diaphragm, heart. They're very close to one another geographically within the body. So what is being missed is this interaction. And I should mention the vagus nerve because that is a cranial nerve that goes to most parts of your body and is particularly irritated with acid reflux and compression and elevation of your stomach, then interfering with the lower part of your esophagus. And the heart abnormalities like slowed heart rate, PVCs, the heart palpitations, those are also associated with the vagus nerve. So it's not just the stomach, the vagus nerve comes into play as well. So hence anticonvulsants and drugs that are trying to alter the nervous system as well. So our problem here is that traditional conventional medicine is very focused on, as I said, a pill for every ill. What's your symptom? How can we drug it, basically? Versus what root cause medicine does, which is what I and my team do, is appreciate the beautiful complexity of the human body, and then concurrently the wonderful simplicity by which the human body loves to be treated. So it likes to be treated with simple, natural means, generally speaking, and responds best to those because you are absolutely kind of supporting the body in its own ability to heal. You're sort of just gently removing obstacles to its healing with diet, nutrition, lifestyle, non-drug approaches. Now, I'm not saying drugs are not sometimes used. Yes, we use them here in the clinic as well, but for us it's a temporary measure to get someone out of a crisis situation, and then followed up with the natural methodologies that then support, regrow, repair the parts of the body that are being influenced negatively by the condition, whatever it is. So in this case, we're focusing on this gastro-cardiac reflex, and what I hear from patients just time and time again, they know, they've been suffering long enough that they see the association, they know their body, yet because they're given no corroboration and no support from their cardiologist or gastroenterologist, they're like, well, I guess I'm wrong. I mean, there's the expert, there's the doctor. But no, you're right. And so I wanted to make this video to have you know that there's a tool for this. And if it's not you suffering, maybe you know somebody who's suffering, because this is a very, very common condition. And unfortunately, when the heart's involved, of course, the first thing you want to do is go to an ER, go to an urgent care, and make sure you're not having a heart attack. Absolutely the first step. But once the heart has been deemed healthy, then now we have to get into the why. And one thing with this gastro-cardiac reflex is what's said in the literature is that it has nothing to do with a diseased heart. And I would completely agree. Yet when you first get that symptom, you want to make sure that everything's okay with the heart. But then when you're left with, oh, your heart's good, then what do? You see? And so I want to make sure that you know there's a lot you can do. And this is something that responds very well to natural treatment, and you don't need to continue suffering. So if you want help, we're here for you. Give us a call for a consultation, and I'll talk to you soon.